Hey everyone, it's just Dr. Andrew Orr here. I'm coming on today because every day I get people messaging me various questions and also about where do they go and who do they see and all kinds of things. It's often a little bit hard being, people don't understand that being a qualified healthcare practitioner is that when people ask answers online and things like that, we aren't actually allowed to give you advice without a consultation. So it makes it really, really hard. It's not like that we don't want to help you, and I understand why people reach out. It's just we're not allowed to. So it's one of the things that I try and explain to people, because I know there's lots of influencers and things like that out there now, and unqualified people who are willing to give people all sorts of advice and things like that. And they can do that, but that's partly because they're not qualified. And this is what I try and get through to people, is that when you're getting advice, you need to go and see a qualified healthcare practitioner. No matter what area you're going to, make sure they're qualified and make sure that they actually do have a special interest in that area that you're actually going to see them for as well. And the reason I say special interest is that some practitioners aren't allowed to say they specialise unless they're a medical practitioner. They're only allowed to say that they have a special interest. It's just due to with guidelines and laws and ethics and stuff like that. But I also know a lot of people ask, well, who do I go and see and what am I going to do with my condition and stuff like that? And that's part of the reason why I'm always out there trying to educate people with broad information rather than giving you advice, so to speak. It's always broad information and give you education on stuff like that. Now, I tell people that when people come to see me, I have a very in-depth consultation. So my consultations take anywhere from about an hour and a half to 2 hours when I sit down with someone. And if it's for fertility, my initial fertility consultation is about 3 hours. And it gives you a rough idea when most people are probably lucky to get like 15 minutes with the practitioner. Now, before I see people, I also send them out comprehensive questionnaires, my own clinic questionnaire, and then I also get them to fill out like a psychological profile to see how they're going, emotionally as well, because it's very important. And then I've got some various online questionnaires that I'll make them fill out as well. And a lot of people, it's a little bit overwhelming. And some people go, oh, it looks like I'm answering the same thing over and over again, but it's just a different approach. It's the same question, just asked differently, and people always answer it differently. But despite that, a lot of people, before they even see me, have sent me in all this information. Now, what I do with that information, it takes me a little while. I sit down and go over all their information they've sent. They might have sent pathology and all kinds of stuff in. And then I compile it all together and then write a report up based on all the findings and differential diagnosis around that. So that when they actually come in to see me, we're sitting down talking about what they need to do rather than talking about them, because I've already got their picture. Except maybe I might ask a few little questions and stuff like that along the way, and maybe we'll add that into their report. But when I do sit there with them, it's 100% focused on what they need to do moving forward and the management moving forward, what they need to change in their life, how I can assist them. And then if I need to, also talk about the assistance of people in my network, because not everyone can do everything. No one can do everything. I know there's people out there try to make out they can do everything, but you can't. I'm not a surgeon, so I can't do surgery. So I've got to go and find a surgeon. Or say someone needed some emotional work. I'm not a psychologist. I have limited training in dealing with knowing what someone might be going through, and I can understand, like I said to you, we give them mood stress questionnaires and stuff like that to identify things. But when it comes to the actual psychology part of it, it's then for me to refer them on to someone in my network. But when people work with me, I have a very tight network. They have to be the best of it. As I said, I'm always talking about my surgeons. When I work with a surgeon, I work with the advanced trained surgeons, not just any old gynecologist, surgeon or whatever. And they need to be, and we all have a very synergistic approach, and we work very well together. And we all know what our own strengths and weaknesses are. But it's also good for the patient because we're all on the same page. We'll all write each other letters saying, this is what we've done with patient A, B, or C. And then this is what we think needs to be done as well. And it's all, so when people see me, I act like a coordinator. I always say I'm like the conductor. I'm doing part of the assistance, and then I have to then coordinate for others. So what that does is, because people, when they go out there looking for a healthcare practitioner, they don't know who a lot of the time it's now, you'll go and Google it based on a friend's recommendation. But the problem is with friends and family and things like that, it's often perception. If their perception is their reality. So we always joke a little bit that even the worst specialist still has people coming through the door. And you know, those people will still go and see, like, thinking that person's the best person in the world, while others will go, oh my God, you're seeing the worst specialist. But if you get what I mean. So it's about perception as well. So then it becomes, then other people will come into the mix and they'll add their 2 cents worth and their 2 cents worth. And a lot of those people aren't qualified. And then you'll go online to the internet, and then you'll get mixed up with everything as well, and you'll get bombarded with all this information. We often see that with weight loss and things like that. Bombarded, oh yeah, this opinion, that opinion, this opinion, that opinion. And then the poor person gets confused. But it's the same sort of thing. So that's why when I do my consultations with people, it's about sitting down and looking at the 360-degree picture about how I can assist them, and then what other things do I need, and what other professionals do these people need to see, and then I help coordinate it for them so that they don't have to think about it, they don't have to go out, and they'll know that whoever I refer to is the best of the best, and someone that I trust impeccably, and vice versa, who would trust me impeccably too when it comes back the other way. So it takes a lot of guesswork out of it for the patient, because then you're doing it all for them. You say, this is what you need to do. So when I sit down, we've got a plan now. We've got to do this, we've got to do that, that. And you come back and see me, you're going to review it all, going to see how you go with the assistance that I've been giving you and treatments and things like that. If you went to the surgeon, you know, what day you booked in to see them. And what did they say? Are you having surgery? When's that going to happen? And coordinating everything together. And usually you can bring it down to about 2 or 3 people that you just, for me, work with about 2 or 3 very trusted individuals. I always talk about a multimodality approach that I employ myself when I assist people and treat people. Use a multimodality, the practice of different things, but then also we've got other people that come into it as well, you know, like surgeons, or maybe we might have pelvic floor physio, we might have psychologists, and it's working with those to keep it in there so that the patient then goes to that other person and they're like, oh yes, you're from, you know, you're from Dr. Orr, so okay, or they'll send back to me, or oh, I'm from Dr. So-and-so, and they've recommended me to you. So we keep that symbiotic, that synergistic approach of things as well. So that's how I work. So then, as I said, when they come in for their first consult, which can take up to 2 hours, you know, 1.5 hours, we've gone over everything. And then I give them about a 20-page report. which goes through every step of their life, from diet to their lifestyle, what they need to change on that front, whether they need to do microbiome restores and things like that, what other medicines they might be on or supplements they might need to be on, what other treatments that they might need to do for their condition, whether that I do them myself, or as I said, they might need surgery. So then they need to go and see a surgeon, and that will be on there too. And this is the surgeon that you see, and this is the psychologist you see. Don't see anyone else. That's who you see, so that it keeps in that network. And it works the best for the patient. So when the patient leaves, they've got a plan, and it's a step-by-step plan too. It's not everything thrown at once. It's like step A, let's do this. So can there be conservative management first of your condition? Okay, so let's do 3 months of conservative work, see how you go. Is there any change? So we meet that, regularly, and we go over, and then they'll be having treatments along the way. How is all that going? Okay, I feel good now, or I've got reduction in my symptoms and blah, blah, blah. Well, we might continue on with conservative treatment. But then we might get individuals that have come in that are at the extreme, the 10 out of 10 pain, and that they're going to need some form of surgical intervention. So you will look at them very differently while we do the step-by-step approach. I would have already gone through their paperwork and gone, well, they've done everything on a conservative. They've done X, Y, Z treatments previously, and they're still in pain. They need to look at surgical intervention. So we put them into that. But then when the surgeries and all that are done, you've got to have conservative management again. Otherwise, you'll end up back in surgery again. And we see that with endometriosis. A lot of people will have the surgery and then do nothing. No conservative management, no pain management. And they're stuck out there in Never Never Land on their own, getting depressed, in more and more pain, and the pain comes back. And then they're in for surgery after surgery after surgery, because they're just employing one approach. And we know that despite the best medical interventions, that people with endometriosis are still in pain. They still have things, because when they're not looking at it, it's a team approach. For any health condition, not just endometriosis, needs to be a team, synergistic, multimodality approach. And that's how I employ when I do my stuff with people. That's how I work. So I thought I'd come on and talk a little bit about how, when people go for, that's how it should be, and it should be working in that tight network. Unfortunately, it doesn't always happen. So people say, but I can't come and see you per se. But now we have online, so people can see me. Like, I see a lot of people online that are out west. They live in a great distance away. They could be an hour away. They could be 10 hours away. They could be interstate, or they can actually be overseas. And now with networks of people that I trust, I even have people I'm working with overseas, so I can go, right, I can help you with this, this, this. And then when you're over where you are, you might need to see the surgeon over there, and this is who you go and see. And you might go and see this other person, but I'll help you coordinate it all and help with the overall match. So you've got someone guiding you the whole way. It's like when you go on an expedition, you don't try and go and do it on your own, or you don't try and go and buy a house on your own, or you'll need that middleman, like you'll need the real estate, or when you're going on a trek, you need a guide to take you somewhere. It's always better with the guide, where you won't get lost. So I tell people I act like the guide or the conductor, and that's what most people are lacking, and they don't have, and they're trying to do it themselves. And I like to just say to people, you can't do it on your own. You can't treat your own health condition. Even if you're a healthcare practitioner, you should not be treating yourself or trying to treat yourself, because you're biased, you're compromised. But similarly, if you're just the general public, you can't treat yourself. Like I had I'll share a story. I had a lady on last week on Friday come and said, oh, my estrogen shot and blah, 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 blah. And I said, how do you know that? Have you just had some blood tests? No. So how do you know that? Well, I Googled my symptoms. And oh my God. And if anyone that knows me knows that I hate Dr. Google, I think it's the worst thing. I think a certain amount of education is good. But let's face it, there's been plenty of things, about 70 to 80% of the stuff that you read on Google is misinformation. And anyone can put up a website now. And then a lot of the stuff, I've talked about this on previous videos, even the research that the public can access is usually 10 years old. The new stuff, you have to pay for it, and you've got to have subscriptions. You've got to be a qualified healthcare professional to get that. So this is what I mean. When you come to see a professional, you're seeing someone that's done all the years of study. They've been in clinical practice for how many years? They're most likely seen everything there is to see. And that's a good practitioner, and they will employ and use as many tools of their trade that they can, and use that multimodality approach rather than the blinker. No, and that's what happens with a lot of people, and why they get missed and dismissed, as I say, because they're just seeing the wrong people. And let's face it, that in healthcare, it's like any other profession. There's good and bad. There's good and bad. There's people that are not so good, and there's some people that are really good. And it's like the whole 80-20 aspect. There's usually about 80% that are and 20% that are probably really good. And that's the ones you have to see. But finding those people for the general public is quite hard. And that's why I say to people, like, when I talk about things, if you want my assistance, then I act as your guide and help you with all of that. And as part of what I might treat you and how I treat you as well. So say to people, I can't do everything, but there's some things I can do, and I'll help you with all that as much as I can. But the stuff that's out of my field or my scope, I will refer to someone, but in my network only. Don't, because I see it when people try and go and find their own. We say too many cooks spoil the broth, and that's what happens, and you could end up, and that's where a lot of people's problem is, that they just haven't seen the right person in the first place. So I just wanted to explain a little bit about how I work. I also wanted to explain to people a little bit about why I can't give advice when people often send me stuff. I always say that to people when I'm with them or doing seminars or public speaking events, that there's no such thing as a stupid question, because there isn't. The only stupid question is the one that you didn't ask. But there are certain limitations to what a qualified healthcare practitioner can and can't say too. It's the same on social media. It's the same on websites. We can't put everything up that we do. We can't do a lot of things because we're governed very, 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 very tightly. So we have to be very careful. So it's not that we're trying to ignore you. It's just we're not allowed to legally and ethically. So I always say to people, unless you're coming in for a consultation, I can't really give you that advice. Yeah, whether it's for fertility, whether it's for for endometriosis, PCOS, or anything got to do with health, you can't do that. But when you come in, I say to people, they come in and have a consultation with, well, they get my time. They get about an hour to 2 hours of my time, and again for fertility, maybe 3 hours. For the couple. So when I see fertility, that's the only other thing I tell people is, when we do fertility, you have to see the male and female. That's if you're in a heterosexual relationship. If you're in a same-sex relationship, I still want to see your partner as well. If you're single, then you can come on your own and bring a support person. But when it's fertility, yeah, generally in a heterosexual relationship, you have to see the male and female. You have to, because there's 50-50. You've got to evaluate both. All right, I hope that explains a little bit more about things, and I hope that helps. And if anyone does need assistance with any women's health issues or fertility or or any health issues, you can always ring my staff up, or you can drop an email or whatever and find out how I may be able to assist you. But I always say to people, when I do assist you, I do have that no stone left unturned approach, and I will go out of my way to make sure that you are looked after on every step of the way, step by step, and that whoever I'm working with you will do that as well. And if anyone doesn't, I'll step on their toes as well. But yeah, it's about looking after you 100%. I hope that explains a lot of things. Take care and have a good day.